I've spent my entire career in healthcare, 26 years now, in the US, working from all sides of healthcare, provider, patient, insurer, government. And I got into healthcare very early on in my career, but I got into blockchain not because I like blockchain as a technology, but because I had a problem that I've been trying to solve for 20 years, and it seemed like a perfect match. So it was more of a searching for a solution and then stumbling upon blockchain and realizing what it can do. But before we talk about technology, I want to talk about what I do. I work for a 3-year-old. That's my son. And the reason I bring him up is that my entire career has been in healthcare. I worked for 2 presidents implementing their priorities in healthcare, health savings accounts, and expansion of Medicaid, and health insurance exchanges, and health information exchanges, you name it. I've been a CIO of a Blue Cross Blue Shield, and I've worked with many clinical systems. But when it comes to coordinating the care of my 3-year-old, despite my Rolodex, it's a nightmare. He was diagnosed about a year ago with a significant disability, and that changed our life. All my wife does now is coordinate his care, and it's all manual, and it's ridiculously complicated. So I got to question all the fancy systems, data centers, and blinking lights that I owned and built as a CIO. None of them actually do what matters, which is to facilitate care, not police care, to facilitate my ability to ensure good outcomes, not stand in the way of them. So I started to question the entire system that we have built and started to look at how do we do it differently. And the answer is really what led to Solve.Care as a platform. So let's talk about what we are doing. We are building a healthcare administration and payment platform that includes the 3 key stakeholders: the utilizer of care, commonly known as you and I, or the patient; the provider of care, which is known as a hospital, a doctor, a pharmacy, a lab, a healthcare aide, whoever is delivering care; and then finally the payer of the care, which can be my employer, could be Medicaid, Medicare, or could be my insurance company, or it could be me writing a check. And the goal is to define the processes that govern access to care, utilization of care, and payment of care between these 3 parties very differently. The irony of healthcare is today, in the US and worldwide, that healthcare is not managed, it's policed. The role of many administrators is no longer to facilitate care and produce best outcome. It's to make sure that the right care is delivered by the right person for the right reason. And the way we administer it looks like a policeman's job, not a facilitator's job. So we have built centralized systems and centralized processes and very, very, very expensive eligibility, enrollment, payment, adjudication, case management, utilization management systems that actually neither talk to each other, nor do they help achieve the goal. So that's what we're after. So fundamentally speaking, we are looking to use blockchain in a way to change the way enrollment, eligibility, pre-authorization, referral, adjudication, billing, payment works. That's what we're after. We're not after clinical records on chain. That's somebody else's problem, and they'll solve it, and many companies will. Our job is to make sure that the plumbing of healthcare works better. And the problem we are solving are not just a US issue. Whether you are a self-pay model in the developing countries, or you're a fully subsidized model like UK, the problems are still the same. You still have to manage scheduling and appointment and referrals and specialty care and procedural care and so on and so forth. And those processes are still fundamentally orthogonal to the interest of the patient and the provider. So we are building a chain that allows these transactions to occur. Without me, the insurance company have to sit between the 2 of you. We can delegate things like direct billing, direct payment, direct referral, direct pre-authorization. And I, as an insurance company, can focus on actually managing risk instead of managing your actions. So there are 3 parts to this: care wallet for the provider, care wallet for the patient, and care wallet for the administrator that allows me to access the chain for the function that I need to perform without having to be in between the direct interaction between patient and provider. So it's a care coordination, care event, care administration, and care payment platform. With that said, the power of this platform is that based on the country and the delivery model we're dealing with, you can issue distributed applications around those 7 functions that are specific to the regional, regulatory, and financial model. These applications are called care cards. So you can issue a care card to handle eligibility in the US differently than a care card to handle referral in the UK differently. And the community can use the wallet and the chain underlying with its capabilities to issue cards that are relevant in China or in Colorado differently. But the functions are still the same, and we provide that fabric. So there are 4 key categories of cards. There is a clinical card, which deals with preventative disease, episodic problems, chronic disease, and palliative and other long-term issues. Administrative card, for example, for making appointment between patient-provider, doing a provider-provider referral, doing a post-care summary document, and so on and so forth. Things that need to happen for care to work, but for them to happen in a way that they don't impede care for you. And then there is a financial card for billing, payment, adjudication, and settlements and reconciliation. And then there's technical cards to do things like proof of service to ensure real-time payments can occur. So we are currently, we have just signed a large care delivery network in the US to deliver our care wallet to thousands of physicians and hundreds of thousands of families to use to do exactly the functions that we've described. And we intend to take the platform worldwide. We are currently doing a pre-sale, token sale for our platform. And the token sale is really divided into 2 parts. The pre-sale that's underway today, and then the token sale that opens on February 21. And if you stop by our booth, there is actually a bonus for attendees of this conference for the pre-sale. A little bit of statistics around what we are doing. We have issued 1,000 million or 1 billion CAN tokens, which is a platform token, that is needed by our clients to access the platform and configure their care networks. CAN tokens are also needed to issue what's called Care Coin, which is the payment coin that our client issues with a guaranteed value, guaranteed redemption. So if I'm an insurance company, I issue my Care Coins. My doctors, my labs, my pharmacies, my ambulance driver, my medical evacuation helicopter pilot knows that they can redeem that coin to get paid, because I'm the guaranteed redeemer of those coins. So those are non-speculative guaranteed payment tokens. But the CAN token is the one we are selling in the open sale, which lets you access the platform, publish your care cards on it, and use the care wallet and the care cards. So with that said, I want to go back to what we are really after. We are after changing the way healthcare works. And the functions that we are going after are really the administrative and financial. And the tokens that we have developed are really the intelligent payment currency that makes it very easy for me as a user of care or a provider of care or as an administrator of care to streamline the processes that today every one of us in the room hate, including my wife, who does nothing more than coordinate care for my son. So that's our vision and mission, and I would welcome if you would stop by our booth and chat with us. Thank you very much.